Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bish, BDS by degree and a pharma professional. As a founder of CareerInPharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey. Hello everyone. Once again, I welcome you all to CareerInPharma. Now in today's video, I am going to talk about medical scribing, which is the very most common question from our viewers, students and from our community, where they want to understand what exactly it is, salary structure, companies hiring for medical scribing. Now in this video, we are going to talk about medical scribing. First, I will tell you what is medical scribing. Second, I will tell you what exactly is the nature of work. Third, what are the salary expectations. Fourth, what are the skills required. Fifth, interview questions for medical scribing. And sixth, last but not the least, is companies hiring for medical scribing and medical scribers. Yes, so here I am going to begin this video, and before I begin, please guys subscribe to our channel for more information like this, and if you have not shared this channel to your friends, please do that also, so that we can make more impact and we can help more and more people in this journey. Yes, so let's begin. Now first of all, what is medical scribing? Medical scribing is a process where medical scribers work, and scribe is a very common term, and meaning of scribe is clerk. So it is related to documentation of what? Medical terminologies, medical information. Yes, so medical scribing refers to a practice of documenting patients and physician interaction. So whatever interaction the patient and physician, doctors are having, you have to document. Now this documentation you have to do in real time, or maybe you will get pre-recorded audios where you have to listen to those audios and you have to make a document on that interaction conversation. Now a medical scribe, people who do this medical scribing, they are called as medical scribe. Medical scribers. So now medical scribe is a trained professional, because company give you training whenever they are hiring you. So they are trained professional who works alongside healthcare professionals like physician, doctors, surgeons, as well as nurses, where they have to accurately record patient information, their clinical assessment, treatment plans, surgical history and other history, whatever is relevant to that particular patient case. Yes, so for documenting all this thing, medical scribe uses a electronic health record system. So there is the electronic EHR, electronic health record system, where you have to input all the data, whatever conversation, interaction the patient and the physician is having, that interaction. Yes, so why we are doing this? So that the healthcare professionals, the physicians, doctors, the surgeons who are dealing with patient, they can focus more on patient care and less on administrative tasks. So their administrative task as a medical scriber you will be handling. Okay, so it's basically documentation work. Yes. Now the role of medical scribe may include recording the patient's history, examination findings, laboratory data, diagnostic test results and treatment plans. And this documentation is very crucial. Now this is very crucial for maintaining accurate and up-to-date medical records, and which facilitates the communication among healthcare team members, and overall it provides efficiency in healthcare setting. Yes, because doctors, physicians, surgeons, they can focus more on patient without worrying about the administrative task. Now second thing is, what is the nature of the work? Like I already told you, as we are dealing with all clerk documentation kind of work, So definitely the nature of work is all documentation, and definitely in today's technology era, we document each and everything in laptops, computers. That's how it works, right? So nature of work will be sitting desk job, and this is sitting desk job into laptop, computers, whatever the company provides to you or whatever the job demands. Now at a fresher level, when you join any company as a medical scriber, then at the initial years of your job, what you have to do, you have to go through the audio. Now this audio can be real-time audio as well, means whenever the physicians and the patients are having conversation real-time you can hear it, or the company will provide you pre-recorded audios. I mean, depends on what is the company's requirement and how is their client is going to work with them, right? So initial years of your life, definitely you have to listen to those audios. So mostly even in sitting desk job, most of the time you have to wear the headphones actually. That is the requirement of this job, definitely for few years for sure. Maybe going forward, if you get promotions or if you deal with some other process inside medical scribing, then might not be you have to wear those headphones, but yeah, initially you have to wear those headphones continuously, because that is the real work actually, because you have to convert that conversation audio tape to the document, right? So that is the nature of the work. Now third point is salary expectations. Now salary varies depending on the company's their budget, right? So salary may vary anything between 3 lakh to 4, 5, 6 lakh even. During COVID-19, I heard companies giving even 7 lakh of CTCs to freshers. But might be the scenario is changed now, but still if you are a fresher looking for a job into medical scribing, you can expect anything between 3 lakh to 6 lakh, and also it varies, depends on company's budget. How was your interview, your qualification, and how good are your skill set. So 3 to 6 lakh may go up to 7 lakh also. Yeah, so this is the salary expectations. Now fourth point, which is very important. Why very important? Because if you are ready for medical scribing, you should know what are the skill sets required. Very, very important. Because without skill set, just based on your graduation degree, you can't get this job. You need to have this skill set for sure to grab opportunity inside medical scribing. Now first of all, you should be a good listener for sure. For this job, medical scribing, you should be a good listener. You should be having a good writing skills, and overall your medical terminologies, concepts should be very clear. Now considering it's a medical scribing, definitely companies prefers healthcare professionals. Even MBBS companies hires BDS, BHMS, BAMS, physiotherapists, even nursing graduates, and nowadays they are hiring pharma graduates also. So basically, in nutshell, qualification wise, if you are a healthcare professional, definitely you can work inside this field, along with if you are a pharma graduate also, then also, because even in some cases pharma graduates are also well versed with all the medical terminologies, especially doctor of pharmacy. They can go for this because they have a good sound clinical knowledge. So yes, these are the qualification wise. Other than this, skill sets required are, so first of all, you should be having a good understanding of medical terminologies, which is very essential to accurately document patient information and clinical encounters. For example, if let's say in the audio conversation, if the physician is telling to patient that if the physician is asking the patient about the patient complaint history, how it happened, how it started, so you have to carefully listen to everything, and in this, if any medical terminologies the patient or the physician is using, you should be well knowing that medical terminologies. That's how you will be able to document the things accurately. So medical terminologies you should be knowing. Second thing, very important, is attention to detail. So medical scribers must be meticulous in recording information, ensuring accuracy and completeness in the documentation of the patient encounters. because if you are not looking for details, you may miss major things, and which may lead to some miscommunication, misinterpretation by physician also, right? So attention to detail is very important. Your typing and computer skills should also be good. You should be proficient in typing, and you should be familiar with electronic health record systems, which are very crucial, because whatever inputs you are going to give, that you have to give inside electronic health record system, EHR. And as a scribe, you often have to input data in real time. Real time means actual real time conversation happening between the patient and the physician. Then you should be having a good communication skill. Why? Because let's say through audio, if anything is not clear to you, definitely you need to communicate with healthcare providers, doctors, physicians, colleagues. So definitely communication is very crucial and vital for this medical scribing role, because you need to you need to clarify many things if anything is not clear while listening the audio, right? Then another important thing is anatomy and physiology knowledge. You should be having a good command on anatomy and physiology. You should be having a basic understanding of human anatomy and physiology, yes, which will help you to comprehend the medical discussions and accurately document the relevant information. Then time management, very important. It should not be like that. Time management, why important? Because you are going through the real time audio conversation. For that, time management is important, because in that limited period of time, you should be able to look for the details, you should be able to document as well. Even if it's pre-recorded audio, you can't give more time in a single audio, so you have to be very time efficient, and your time management should be very good. You should be having a good adaptability, because if you are a healthcare professional where you have just learned about clinical stuff, you just deal with live patient. Yes, so you should be adaptable to work inside this non-clinical sector where you have to just do the documentation work. You should respect confidentiality. Yes, scriber must adhere to strict patient confidentiality and privacy regulation. So confidentiality, you have to keep the patient information confidential. Teamwork should be there. You should be able to collaborate with healthcare providers, nurses and other members of healthcare team, which is very essential, and medical knowledge is very important. Okay, so in nutshell, definitely if you are from a medical background, healthcare professionals, for you to get inside medical scribing is very easy, because definitely medical knowledge is required without doubt. Yes, now another very important question is interview questions. See, I am not going to give you each and every individual question, specific question, because that may vary depending on the company's interview. But overall, you should be having a good command on anatomy, physiology, and a good command on medical terminologies. Yes. So try to focus on different organs and organ systems, specifically skeletal system, circulatory, urinary, digestive system, nervous system. And also try to read upon the epidemiology of various common disease and disorders along with their prevention and cure. Yes. Now these is basically the interview questions, the topics which you can prepare, right? Basically pharmacology they won't ask, it's all about disease, their diagnosis, prevention, cure. So more of medical things they will ask in the interview. And in the interview process, first of all, because there is a good requirement of listening, writing. So in interview, first will be your aptitude test, followed by a skill test where they will ask you questions from medical background. They may also check upon your writing abilities. So there may be essay writing test. There will be audio listening test where they will see how you are look for details, minute details. So yes, aptitude will be there. Main technical round of medical questions will be there. Writing assessment will be there, and then audio listening test will be there. Means what you interpreted after listening to the audio. So by this they will check how minutely you look for the things. Yes, and personal interview where they will ask about your basic background, what you did, when you did, why you want to come to medical scribing, and many other personal questions they may ask you. That is the personal interview, and followed by HR round obviously. Now I am going to talk about the company is going to hire for medical scribing in India. So if you are in India and you want to apply for medical scribing roles, see, there are many other companies also, but I am just going to give you names of the famous renowned ones, but there could be many small companies which even I don't know. Yes, so the most searched and most popular companies is, first of all, IKS Health. I guess it's a Mumbai based company, so IKS Health is number one company for medical scribing. Then Equity Solutions India is also there, then Only Group Healthcare, and Indivitas is also there, IDS Infotech in Noida, and Cognizant is also there. Okay, so these are the most popular companies hiring for medical scribing. Yes, so this is all about medical scribing, how you can do it, and I hope this video going to help you for your medical scribing preparation, and I hope this video help you in understanding what exactly is medical scribing. Yes, so if you like this content, please don't forget to subscribe to our channel. Please don't forget to like this video and share it with your friends. Yes, and we'll be coming soon with some fresh next video. Till the time I come again, till that time, please stay safe, aware, healthy, updated, and keep exploring new things. Thank you. Have a nice day.